Colorado for explaining the impact the virus is having on the most vulnerable communities. I'm delighted that we can also welcome now Honorable Dr. Nadiru Hamed, Mauritanian Minister of Health, to provide a country perspective, and Lubna Hashmat from the Civil Society Human and Institutional Program in Pakistan. Lubna, may I turn to you first to share your reflections?
Thank you, Jen. So I would like to share the World House that 9.6 million zero-dose children live on the earth today. About 50% of them live in fragile settings, and the remaining 50% are scattered in multiple settings, such as urban slums or hard-to-reach areas or invisible pockets of low and middle-income countries. In these settings, living conditions are volatile, life threats are high, food scarcity is common, and access to health services, especially immunization, is weak. Due to ban on inland movements and lockdown restrictions, confinements are common. Opportunities for livelihoods have got very, very limited. COVID-19 pandemic has proven that virus does not follow any immigration rules. It transmits with high intensity and leaves disastrous impacts on everyone, but it hits most the vulnerable population in the form of acute illness or death. The high number of zero-dose children in these locations pose a bigger challenge: the outbreak of vaccine-preventable diseases. The pandemic has exposed that regardless of the income levels, the countries of the world are not ready for managing sudden high-scale pandemic. Although COVID-19 has become a threat for everyone, but it provides us an opportunity as well. We need to look at that how we can know the scale and geolocations of vulnerable population so that preventive strategies can be drawn and implemented. Most of the countries are assisted to prepare evidence-based national deployment and vaccination plans, especially for inclusion of vulnerable population. We can easily plug in childhood vaccination plans as well. If countries are making efforts for improving capacity of their health systems, why can't we do it holistically for improving the system for covering zero-dose and childhood immunization at large? The experience has taught us that regardless of low and middle income status at the country level, we can monitor the spread of deadly virus. And if we publish the data for the sensitization of common people, it raises high level of awareness. This practice can be replicated for covering zero-dose children as well. Innovations are required, not only for vaccines, but also for demand generation for all vaccine-preventable diseases. As the world context have changed, let us come forward and strive for building better, protecting better, regardless of any difference at nationality, religion, gender, or ethnicity, or any other difference. Thank you, Jen.
Thank you, Lubna, for speaking about those possibilities. And now